Hey, my name is Dr. Sean Price. This is our final video on our stress and adrenal, our stress and hormone video series. We're talking about how stress can specifically and very detrimentally affect hormones in both men and women. Okay, so we've gone through and we talked about the hypothalamic pituitary adrenal axis. We talked about how stress affects that and how the adrenal glands can actually wear out, ending up giving us low cortisol levels. So if you haven't seen all this yet, then go back and watch the other videos so you can get caught up to where we are. Now, first of all, how do we determine if you have low cortisol levels? Well, there are two different ways to test. First one is through the serum. Second one is through saliva testing. In my practice, we prefer to use saliva testing. And the reason for that is because I'm interested in knowing what the cortisol levels are in the blood, but I'm more interested in knowing how much has gotten to the tissue and how much has been metabolized. And that's what the saliva testing shows us versus the serum testing. Also, the serum testing is usually done at a certain time during the day, just like one time. Saliva testing, we collect it 4 times during the day so we can make sure that the hypothalamus is sending the right signal to the pituitary gland for the adrenal glands to carry out their normal function. You should have a downward cycle with cortisol levels being higher in the morning, comes down a little bit at noon, a little more in the mid-afternoon, and in the evening it should bottom out. So you want to see these levels, and we can see that with saliva testing. So that's how we can determine if there's adrenal fatigue, if it's just hypothalamic, or if it's just adrenal fatigue, or if it's also hypothalamic pituitary adrenal axis dysfunction, or what exactly is going on. So that's option number 1. Okay, so we have the decreased adrenal function. How does this affect hormones? Well, it's very, very, very interesting how this happens. So your body makes cholesterol. Cholesterol is released from the liver. Okay. Number 1, if you have low cholesterol because of medication, you're going to have hormone problems. Cholesterol is critical in the production of hormones. It's a whole other video series about the dangers of cholesterol lowering medications, the effects of them, the efficacy of whether it actually helps reduce heart disease. It's actually very simple to lower cholesterol without medications, and if you want to know more about that, call the office. I'll be glad to discuss that with you. But anyway, so back to this. So we're assuming that you have normal cholesterol. Cholesterol then converts into pregnenolone. Now we consider pregnenolone to be the mother hormone because all other hormones come from pregnenolone. So when this pregnenolone is formed, it's going to split its resources into the other hormones. So what it's going to do is it's going to become progesterone. Now this is a very simplified pathway, but just keep in mind this is how this works. Okay, so it's going to go into progesterone, which will then go up into cortisol, DHEA, testosterone, and estrogen. Okay, so cholesterol converts into pregnenolone, pregnenolone converts into progesterone, which converts into cortisol, DHEA, testosterone, and estrogen. So in this situation where the adrenal glands are fatigued and your cortisol levels are low, we've already discussed how this hypothalamic pituitary adrenal response is a life-saving response. It's critical to life. So it has priority. So if your cortisol levels are low, the body's going to start siphoning these resources. And it's going to start taking these resources and try to really focus on get those cortisol levels up. Well, what does that mean? That means that your progesterone, your estrogens, and your testosterones are going to go out of balance. Okay, so these guys are out of balance. Now you have hormone dysfunction. If you're a male, you might present with low T. If you're a female, you might present with high testosterone, high estrogen. You won't have progesterone to oppose it. It's hard telling how that imbalance is going to occur, but you're going to have this imbalance. Now, another thing for men, especially, testosterone in the presence of stress and in the presence of some other factors can actually aromatize into estrogen. So if you have excess testosterone in your system, your body, to protect itself, will aromatize that testosterone into estrogens. And so that can lead to problems for men that take bioidentical hormones for too long. So there's a lot of issues here. But the main thing to understand is if the adrenal glands are fatigued, it's going to cause hormone imbalances. It's almost inevitable. Now, what else can cause those hormone imbalances on top of that? Well, this is the main cause that we see in our office. Happens all the time. A lot of times, I'd say 80-90% of the time, you get the adrenal glands under control. You get blood sugar under control. Now, this is important because blood sugar is a stressor. If your blood sugar is not under control, that will cause this whole process to happen. You get adrenal glands under control, you get the blood sugar under control, and a lot of times the hormones will balance themselves out naturally. It works really, really well. Sometimes patients will come in and they've been on hormone replacement therapy, and they've been on it for a while. So what happens with that? Well, when you start taking hormones from external sources, what we call exogenous hormones, your body is a protective mechanism. And if you have too many of a hormone, then your body, it can damage cells. So what happens is within 2 or 3 months, your body can actually start down-regulating the receptors on those cells for those specific hormones. So that can lead to further imbalances. So now you're not only dealing with adrenal fatigue, but you're also dealing with down-regulation of the receptors on the cells, and you're getting yourself into a chronic condition. So it's really, really important that you get in there and you handle the stress, you handle the adrenal glands, and you get everything built back up. So in the next video, I'm going to go through some steps that you can do that can actually help you do that.